Okay.
the amyloid beta controversy.
Oh, nice.
Dun, dun, dun.
The body's trying to protect itself.
That's right. We've been saying that for years, haven't we?
Okay, and we're live.
We're live. It's Tuesday, 4 o'clock Pacific, 5 o'clock here in Costa Rica, 7 o'clock on the East Coast, midnight in Dublin, 1 a.m. in London and most of Europe. I think Poland, what is it in Poland? Do I have it in Poland? Yeah, it's 1 a.m. in Warsaw also, 4:30 a.m. Wednesday morning in New Delhi, 11 a.m. in Auckland, New Zealand, 9 a.m. Wednesday morning in Brisbane, and it's Facebook Live. Hi, everyone. It's always great to see where you're tuning in from. So give us a shout out, say hello, tell us where you're from. And this is my favorite Facebook Live of the month every month because we get to get Michelle here. Hi, Michelle.
Hi, Dr. Tom. So happy to be here. Looking forward to all these questions.
Yes, yes. And for me too, it's really a lot of fun. And I had a question I wanted to start with that came in last week and we didn't have time to deal with it. So I wanted to get to it today. What are your thoughts on the recent discovery that decades of research was based on the connection between amyloid beta and Alzheimer's was faked? Is there anything we can really do? And that came from Ann, and that's just a great question. So here's the story. We've all known forever that amyloid beta was a problem, but then there were studies that came out that said, wait a minute, amyloid beta is part of an immune response to protect you. So there was this controversy as to, well, wait a minute, all the research says amyloid beta causes Alzheimer's, and we've all believed that. Turns out that these researchers, one guy in particular and his team, in the #1 study that's been referenced over 2,000 times in other Alzheimer's research papers, they use this study as their reference for whatever their line of thinking is. The guy forged the pictures. You take pictures of, it's called Western blot. It's a way of marking how much of substances is, how much of components are in a substance that you're testing. And you see these little bars. He copied and pasted a number of different Western blot graphs into one graph to prove the point that wasn't true, that amyloid beta is not the problem contributing to Alzheimer's. Turns out that there's good amyloid beta and there's bad amyloid beta. The soluble is the good stuff. That's the immune system. When it sends amyloid beta into the brain, it's there to protect you. And it's fighting bacteria or viruses or something. But there's another form of amyloid beta. There's good guys and bad guys. The other form of amyloid beta is called insoluble amyloid beta. It doesn't break down. It's this sticky crud that accumulates in the brain. And that is a problem and a strong contributor to Alzheimer's. But the paper that was published about I think it was 2007. I don't remember the date, something like that, where he forged the pictures. He said all amyloid beta is a problem. And it's not. It's not. It's the insoluble amyloid beta that's the problem. And that it is a problem. So with all of that said, what do you do about it? Well, we've known in the Journal of Alzheimer's Research, this paper came out in 2010. Colostrin, that's a component of colostrum. Colostrin alleviates amyloid-induced toxicity in the test animals memory center of the brain called the hippocampus. In this paper that came out in 2008, I think it is. Let me get my glasses here for this one. This is really important for 2009. Colostrum nanopeptides affect amyloid beta aggregation, which means the sticky stuff. That there is a component in colostrum that there are many different components in colostrum, but these proline-rich polypeptides, these PRPs, are actually very good for you. And what they do is they help to dissolve this insoluble amyloid beta, and they reduce the production of the insoluble amyloid beta. So you don't make as much of this stuff, and you get rid of some of it that's been accumulating in there. And in this paper, colostrum decreases hypersensitivity and allergic responses to common allergens. It's not just for the brain. It works throughout the body. It helps the immune system dramatically. And in this paper, in the Journal of Alzheimer's Research from 1999, colostrum, a proline-rich polypeptide complex from colostrum in the treatment of Alzheimer's disease, a double-blind, placebo-controlled study, which means that nobody knew who was getting what products. And the result was colostrum really worked. They said 8 of the 15 Alzheimer's patients treated with colostrum improved, and in the 7 others, the disease had stabilized. In contrast, none of the 31 patients who were given selenium instead of colostrum, or were given a sugar pill instead of colostrum, none of the 31 patients from the selenium or placebo groups with similar mild or moderate Alzheimer's improved. So those with mild Alzheimer's who were given colostrum, 8 of the 15, about half of them, got better, and the others stabilized with a year of therapy. So this is not something that works in a week, but these proline-rich polypeptides, they really do work. They're great for you. That's why we put the product together a number of years ago, the GS Immuno-Restore PRP spray. The spray is just the concentrated colostrum that they're talking about in these studies. So you do the spray, you do 2 pumps twice a day. It tastes pleasant. It's easy enough. Let it sit in your mouth for 15, 30 seconds. You know, you get the taste, it gets into your taste buds, sends messages up to the brain that colostrum is here, and then you can swallow it down. It's an impressive product. And I haven't been talking about it in the last couple of years. And after seeing this article that came out in Science magazine about I think it was about 9-10 weeks ago now, about the fraudulent actions of these researchers. And it's like shame on you for doing this, because millions and billions, I think, of dollars have been spent on Alzheimer's research. And it's why there's never been a drug that's effective in stopping your body from making amyloid beta. So all the people that were working on drugs to help with Alzheimer's were looking for something to stop amyloid beta. You can't, it's part of the immune system, but you can stop the insoluble or slow down the insoluble amyloid beta. That you can do, but none of the researchers were differentiating, because everybody knew it's amyloid beta that causes Alzheimer's, because that one paper set the stage for it. Michelle, do you want to add to that one?
No, it's upsetting, for sure. But it's also like this beautiful testament to how amazing our bodies are. They're constantly trying to protect us.
Yes. So amyloid beta is not a bad guy.
Mm-hmm.
It's not a bad guy. The soluble amyloid beta is a very good protective component of your immune system. Really good point to bring up. Thanks so
And
much.
the PRP spray is very pleasant. There are plenty of unpleasant things that we do in the wellness and healing process. PRP spray is pleasant.
That's true. That's true.
Okay, next question is from Anne. What are your thoughts on the recent discovery? Why am I hearing sound?
Well, that's the one that I just did. That's the question I just did.
Oh, sorry, you're right. I'm meaning to read the second one. I was hearing myself in stereo. Okay, this is Lori from Illinois. I'm wondering if it's okay to take vitamin C alongside with probiotics. I know vitamin C has antibacterial properties. Thanks for providing this wonderful Zoom meeting for us today. Thanks, Lori.
Thank you. Thank you. That's a really good question, Lori. And when you're taking mega doses of vitamin C, for example, Marzi and I take 4,000 milligrams. We take Vitality C. That's the one we use. We'll put the link in there for it. I like it more than anything else because it also has ribose, and ribose is a fuel for the furnaces in your cells called mitochondria. So this vitamin C gives you ribose, so it gives you a little bit more energy along with all the benefits of vitamin C. And one scoop of this, and every morning, that's my job, is to make the coffee and to put out our 2 big glasses of water. And I put a scoop of Vitality C in each of our glasses. So that's the one we use. And when you're using higher doses of vitamin C, I would not take it at the same time as the probiotics. I don't know of any study that says there's a problem with that, but that's really a good line of thinking on your part, that it's probably safer. You'll use more of the probiotic without any potential complications when you separate them. Michelle, do you have any further information on that?
I would agree. I haven't seen any research on that, but it makes sense to just take it at a different meal than the vitamin C. And that vitamin C doesn't taste amazing, but it is such good quality.
Right. It's bearable. You know, it's not strong. It's not a strong taste. And what do I add to it? In mine, I add a little turmeric. I add another product from Brain Bean, neurocardio mix. And I put a scoop of that in there too. So mine tastes more like turmeric. Marzi doesn't like the turmeric taste, so she doesn't want that in hers.
So she just drinks it straight up.
She's straight up.
Nice. Okay, this is from Iceland, and it's a question posted on Instagram. This person has sporadic fatal insomnia since 2017. They're supporting it with the Walls protocol and doxycycline.
Okay, the Walls protocol is excellent. Really good. Dr. Terry Walls is great. She's got a great protocol. Can't say anything that needs to be added to that. Any protocol is a shotgun approach. Anything is. So there might be something you'll want to tweak within that protocol, but that's a great place to start. Just a great place. The doxycycline, not such a pleasant thing to be doing long term. It's an antibiotic, and it's going to destroy your environment in your gut. We know that a single dose of an antibiotic has a long-term impact on your microbiome. So doing it, but it's critically important to sleep. And when you need to sleep, if that's helping you sleep, then you stay with it. But we have to find out, why is it that this is working to help you sleep? So that if we can fix the why, you won't need the drug anymore that's got these side effects that long-term are a problem, a big problem. I don't want to say anything against your doctor's recommendations. So if it's helping, great. But antibiotics kill the good guys in the gut. And when that happens, you get more inflammation in the gut. And when that happens, you get more leaky gut, intestinal permeability. And that, when you have the leaky gut, is the gateway in the development of autoimmune diseases. So you set yourself up for an autoimmune disease that you probably won't get the symptoms of it for 3, 5, 7 years. sometimes a little longer, but when you're on that spectrum, you're killing off tissue, killing off tissue, killing off tissue. And you don't feel it until you've killed off so much tissue that tissue can't function properly anymore. Then you start getting symptoms, but it's been going on for a long time. And so once again, the gateway in the development of those autoimmune diseases is a leaky gut. And when you take antibiotics on a regular basis, you absolutely no question about it, you create a leaky gut, a pretty serious leaky gut. So excellent to take if it's helping you to sleep, because sleep is critical, but we have to be exploring why is that happening. And for that, I would strongly recommend you make an appointment with Michelle Ross, and so that she can explore with you what is it about your environment or your lifestyle or your health history, not just your medical history, your health history, that has set you up. So you've got to find out where it's coming from. Critically important. Michelle, do you want to add to that one?
Yeah, there's absolutely a reason for any of these symptoms. I mean, there's a handful of things that are genetic, right? But most of these, there's a reason, there's a root cause. And in order to recover, we have to figure out what that is.
I just gave a holler to Marzi to ask her to come in and help me find Facebook and, you know, to see who's saying hello on Facebook. Can you find and give me that boy? Gio, come here. Yeah, okay. Wait.
Gio. Hi, were you in the swimming pool?
Hi, Michelle.
Did you go swimming?
Yes.
Did you go in the water?
Oh, he did. He did. You know, Gio was grabbing his bucket out of the water yesterday in the pool, and he leaned over to grab the bucket, and he fell right in. And he fell all the way in, and Daddy jumped right in and lifted Gio up, and Gio was like this. Yeah. But then he was laughing afterwards. So we will always be careful when we reach in the pool.
Yeah. Did you fall right in the water? Right in the water? Yeah.
I'll tell you, the pool. Aja, that's the
Outside in
pool.
the
That's where he
pool.
fell.
Yeah.
Yeah.
I like your necklace. Yeah.
Yeah. I just lift him up. Yes. Yes. Yeah. Okay, I'm going to give you back to Mommy now. Say bye-bye, Michelle.
Bye-bye, Gio.
Yeah.
That's a
So for
cute
those of
one.
you that don't have kids, sorry, you just have to bear with us when we do this, right?
Oh.
Yeah.
I mean, we should be spending more time watching videos of laughing babies on YouTube and feeling that joy. So babies just bring happiness.
There you go. You know,
Like a little hit of happiness.
everyone who's here, if you've not watched the Laughing Buddha on the subway video on YouTube, just Google Laughing Buddha Subway, and you'll just laugh your head off. I mean, it's just such a pleasant thing to watch. And you're right about that. Let's see. Let's see what we got here. Patty's here. Patty Lerner. Hi, Patty. Colin's here. And Colin, I believe, is in, was it Scotland? Colin, is that where you are? I've had balance issues over the past year. I had an MRI scan of the brain and neck, which was negative. Good. The neurological diagnosis was vestibular migraine. Nonsense. Even though headaches have not been a major factor. He wants me to take amitriptyline, 10 milligrams, which I haven't started yet, but wonder if there are any natural supplements or treatments for the condition rather than pharma drugs. And Colin is one of our longtime attendees on Facebook Live. I think, sorry, Colin, I don't remember if you're in the UK or Scotland, but it means you're up every night late to watch this. So thank you. So let's take a minute, Michelle, and talk about this balance issue over the past year that he's been having. What do you think? Where would you start?
The gut.
Okay, then I'm going to start. I'll start. I published a paper a number of years ago with some otolaryngologists in Milan. And we talked about the gluten-free diet alleviating Meniere's disease. And Meniere, you don't have Meniere's. If you did, they would have identified it, but it's a balance issue in the brain. And so the first thing, Colin, that I would look for always, I would do the wheat Zoomer. It's going to be a pain in the butt to get the test kit over there, but you can do it. Michelle can walk you through how to do it if you work with Michelle. And you get the test and you send it back to the US, and then it's 2 weeks before you get the results. So this is like a month project to get the test. And I know you're probably going to say, well, I've been gluten-free for 3 years. And I think you're going to be really surprised that you still have elevated antibodies. And that's when you dig deep with someone like Michelle as to where's the exposure coming from. Wow, how is it happening? But that's the top of my list. When unexplained, no problems in the neck, no problems in the brain. The CAT scans are negative, the MRIs are negative. Now, the other thing to look at, and I talk about the pyramid of health, that there's 4 different areas, 4 different sides to a pyramid. So when you have an unexplained problem, you have to look at all 4 sides. And the base is the structure. And as a chiropractor, I've seen miracles time and time again over the last 40 years of balance problems that get alleviated when you have the right kind of treatment for your neck or your upper back. And it just depends. You have to find a good chiropractor to see if that's a component of this. There may have been a history of a car accident or some trauma. You may have been a soccer player earlier in life and you got some arthritis, but the neurologists don't think it's too bad. Certainly not like a disc herniation or something, but you want to rule out the mechanical component, the structural side of the pyramid of health. And then you take a look at the biochemical side. That's where wheat Zoomer comes in, is the first place that I would look. Michelle, anything else you want to add to that?
No, I think that's an absolutely excellent place to start, and we can definitely ship. They actually ship directly from the lab. The kit, you just need to find someone to do the blood draw, and then it includes FedEx shipping back to the lab. So we definitely work with people outside of the US. I think there's maybe 3 countries that we can't ship to.
Great.
But yeah, it works well. Okay,
Magda,
next up is, go ahead.
Okay. Magda is asking, hello, Dr. Tom, wondering if you can explain zonulin. My gut Zoomer zonulin is different than wheat Zoomer zonulin. Is one test more accurate than the other? So the gut Zoomer, so I'm assuming you've done both tests, the wheat Zoomer and the gut Zoomer. And if that's the case, if you're talking about zonulin levels, so for those that don't know, zonulin is the protein that's been identified as the trigger of leaky gut. That what happens is you have sentries standing guard on the inside of the small intestine. They're like the British soldiers, those red hats at Buckingham Palace. They don't move, but don't mess with those guys. So you have sentries inside the first part of the small intestine watching everything that comes out of the stomach. So if there's anything coming out of the stomach that shouldn't be there, like a bug or a bacteria, the sentries call out the alarm right away. And one of the things they do is increase zonulin levels, which mean when zonulin levels go up, right where Michelle is circling, those shoelaces that are holding together, those proteins that are holding together the space between the cells, they just kind of, you untie your shoelaces and your shoes get floppy on your feet. And that's called paracellular, between the cells, between the cells, leaky gut. So zonulin is the protein that activates all of that. So it's a protective mechanism. Now, the thing about zonulin is that the lifespan of zonulin is 4 minutes to 4 hours, somewhere in there. So if you're talking about the level of zonulin being different in the 2 tests, time of day most likely is the culprit there. If you're talking about antibodies to zonulin, that's different. And Michelle's got some pictures here. Michelle, do you want to talk about what you're showing here?
Yes, so she was asking the difference between wheat tumor and gut tumor. So this is the intestinal permeability panel on the wheat tumor. Whoops, didn't mean to draw that circle so big. And there's several different kinds of zonulin or forms of zonulin. So this is whole blood zonulin that Dr. Tom was just talking about that has a half-life of 4 minutes to 4 hours. So was there a breakdown of zonulin, those tight junctions, into the bloodstream on the morning of the test? Then there's also anti-zonulin antibodies, and that's more of a long-term indication of intestinal permeability. And then this is like comparing apples to oranges. This is fecal zonulin. So this is, it's just, they're different. So it would be normal for somebody to have different levels on both tests. It doesn't mean that one of them's right and one of them's wrong.
Right, right. Now, with the lifespan of zonulin in the fecal zonulin on the gut zoomer test and in the blood zonulin, the lifespan is still 4 minutes to 4 hours. So the likelihood is those two markers can be different. It just depends. It depends on the time of day and how long did the zonulin last in the poop as the poop's moving through the body and being eliminated. So that's not a problem when there may be a difference between the blood level and the fecal level. That is not a problem. They're both there because they're different tests. One's a stool test and you're wanting to see if there's any indicators at all. Because if there's indicators of zonulin in the stool test, that's even likely, it's likely higher than what it measures because of the length of time that the zonulin has been produced and then traveling through the gut. Most people's gut transit time is sluggish. Most people. Some people it's really fast, but now how long should it be? How often I'm asked, how often should I have a bowel movement, doc? Well, every time you eat. It's called the gastrocolic reflex, that when you start chewing, messages go down, say, okay, move everything along now. There's more food coming. Let's move it along. So having about well-formed bowel movements a couple of times a day is the ideal. Although most doctors, including me, will accept if you have one good bowel movement a day, every day that's well-formed and good volume, then okay, good. That's adequate for now. That's adequate for now. But some people, their bowel transit time is 72 hours, 3 days. How do you know? One of the simple tests is just eat a couple of ears of corn. And when do you see the first corn in the poop in the toilet bowl? And when do you see the last corn in the poop in the toilet bowl? And it's not really sophisticated, but it works pretty well to give you a sense of, well, that's corn there. Okay. Well, wait, I had that corn 2 days ago. And then you start realizing, oh, my bowels are sluggish. That means stuff is sitting inside of me too long, right? And then you want to work on your bowel transit time.
Absolutely. And I would pay more attention on this test to the antibody levels of the zonulin than I would to the whole blood zonulin or the zonulin on the stool test. And the antibodies are the cleanup crew. They clean up dead cells, dead tissue. So if there's an elevation of antibodies, it means that there's too much die-off of these zonulin cells into the bloodstream, requiring the body to create a bigger cleanup crew. So that's tissue destruction, and that's a big problem. That's the gateway to autoimmune disease. So look at, on this part of the test, look at your anti-zonulin and anti-actin, IgG and IgA. So IgG is more of that long-term systemic chronic antibody or immunoglobulin, and IgA is the strongest response the body makes. So that's even more significant. And then look at those LPS antibodies. If IgA is getting close to 30, or the IgG and IgM combined are above 200, there could be a problem. But great question, Magna.
Yeah, agreed. Agreed.
Okay, Christina says, greetings from Costa Rica. If
Hi,
you
Christina.
have a nutritional deficiency, for how long do we need to take a high quality multivitamin?
Well, if the cause of the nutritional deficiency is not addressed, probably for a long time. I don't want to say forever, but a long time. So if you have a deficiency of vitamin D, as an example, I think everyone should have vitamin D tests done at least once a year, preferably twice a year. That's the one test that I think everyone should have regularly, because vitamin D is so critically important. And if you are low in vitamin D, the first thing is get the vitamin D levels up. But then the question is, why are my vitamin D levels low? And maybe you're not able to get out in the sun. It's a time of year where that's not possible, or your schedule doesn't allow it. Or maybe you're not having enough foods that have, although there's not a lot of foods that are high in vitamin D, there are some that can help, but depends on what supplement you're low on. But looking to see, why am I low here? And when you work with someone and they're evaluating, let's say you've got B vitamin deficiencies, 3 or 4 of the B vitamins. And then with the nutritionist, you're looking at what your diet has been, your food selections, and you see, oh, I really don't have much food that's high in folate or high in B12. Okay, I see, I need to include more B12 foods. So you'll supplement to get yourself up to the levels that you should be. Don't just take 2 bottles and say, okay, I'm done now. No, you take 2 bottles and then you retest to make sure you're up in a normal range. Then you let your lifestyle try and keep you there for a month or 2 months, and then retest again. Okay, good, I'm still in the normal range. That's how you know if what you're doing is working. And unfortunately, it means 3 tests, 3 or 4 tests over the course of 6 months or a year, depending on what the nutrient is that you're low on. Michelle, do you want to add to that?
Yes, I mean, our soil is so depleted, and I know people have heard this on repeat, but the monocropping is absolutely destroying our soil and agriculture. But even, you know, with my garden, I really try to rotate things, and I'm not sure how nutrient dense the soil is, right? So taking a really good quality multivitamin can help to just provide those nutrients that your body needs, but it needs to be a good quality. And so many people are taking synthetic folic acid, and they need more of a methylated form. So, you know, maybe it's not the best idea just to shotgun some of these. It's better to find out if you're taking the appropriate type for you of these nutrients. Some people genetically aren't able to convert beta carotene into the activated form of vitamin A. So it's important to take the type of multivitamin that's going to be the most beneficial for you. And the vitamin D, I 100% agree with Dr. Tom, at least once a year, and go off of vitamin D for 72 hours before you test, because I'm seeing a lot of discrepancy in test results. If you're taking vitamin D, it's a fat soluble vitamin, it can store in your tissue. You want to get your baseline. So if it's water soluble, avoid those for 24 hours before your test. Beta carotene biotin needs to be out for at least 3 days, because it can really impact on certain tests. And then avoid those fat solubles, A, D, E, and K for at least 72 hours before you do the test, and you can get the more accurate testing. Because I've seen falsely elevated levels because somebody took it the morning that they went in for the blood draw, or maybe the day before.
So really good point, really good point. And people wouldn't suspect. Yeah, I take my multiple every morning, or I take my vitamins every morning. Then, okay, I'm going in to get a blood draw today, so I'm fasting. But yeah, I took my vitamins, but I'm fasting. But so then the vitamins are in your bloodstream. You're going to take the blood, and then it's going to register. Oh, you got plenty in your bloodstream, and so just make sure to stay away from the supplements for those lengths of time before you retest. But it's critically important to retest. And that's something that we don't like to do. We don't like to spend the money. And we say, well, I took 2 bottles of the vitamin. That should be enough. Okay. Should be enough. You just don't know. You don't know.
Vitamin D can stop the proliferation of cancer cells at the cellular level. Do you want that only for 2 months, or do you want that indefinitely?
Right.
It's a hormone. It's so critically important.
Jill has a question. Jill's a frequent person here. I recognize your name, Jill. Thanks so much. My doctor ordered a HydroScan for the gallbladder, which involves radioactive contrast. How dangerous is that for our body? I don't know. I honestly don't know the side effects of the tracer dye. They inject a dye into your arm, and then they're scanning the gallbladder when the blood flow is to see how that tracer is going through there. I just don't know, Jill. I'd want to know, what is it they're looking for? What do they hope to identify with it? And asking questions like that of your doctor is often walking through a field with landmines, because they can be offended that you're actually questioning their recommendation. And so you might have to walk gently on that one. Let me just say this. We know that when you have a sensitivity to wheat, so how does the gallbladder work? Let's just start there, right? Your liver makes bile, and it sends it down in tiny little drops to a storage pouch underneath the liver called your gallbladder. So the gallbladder is just holding this really potent bile. And bile's job is to act like dishwashing soap, that when you eat food, the amount of fat in the food, there are cells inside the lining of the gut, inside the tube, food's going through the tube. There are cells there that say, oh, look how much fat there is. We better let the gallbladder know. So the cells on the inside lining of your gut make a messenger called cholecystokinin. And cholecystokinin's job is twofold. You make a certain amount of cholecystokinin, and depending on what you've been eating, and cholecystokinin gets in your bloodstream, and it goes to 2 areas. It goes to your gallbladder, and it goes to your pancreas. So it goes to the gallbladder, and it says, we've got this amount of fat right now, so we need this amount of bile. Bile is like squirting dishwashing soap into the sink and you're washing dishes. And when you don't have the suds anymore, you can't get the grease off of the plate, right? Because you're now you got dirty dishwater, right? You got to get fresh water, squirt some more soap in there. So bile is like the soap. It breaks down the grease. It breaks down the fat in your gut. So you eat a certain amount of fat. You ate French fries, lots of fat. And the inside line of your gut says, whoa, look at all this fat. We need to make cholecystokinin. Cholecystokinin goes up to the gallbladder, this amount of cholecystokinin, and the gallbladder squeezes. Cholecystokinin stimulates the muscles to squeeze the gallbladder, and down comes the bile into the tube, into the gut, to break down the fats. And now you get your vitamin A and D and E and K, all of the fat-soluble vitamins out of the food that you're eating. But what happens when you have a sensitivity to wheat and you've got inflammation in your gut because you're eating wheat or you're getting inadvertent exposures to wheat, your the inside lining of your gut, those cells on the epithelial lining only make about a third of the cholecystokinin that they should. And this is from Mayo Clinic. Mayo Clinic, the article I remember because this was from my godmother who died of liver cancer. And I was reading about all of this. And I remember this article so well, November 2007, the liver in celiac disease, and from Mayo Clinic. And they talked about the gallbladder, and they said, when you only make a third of the cholecystokinin that you need, your gallbladder only works about a third of what it should. So you get reduced gallbladder emptying, increased gallbladder volume. What's that? When you've got gallbladder bile sitting in there more than there should be, and it just sits there for a long time, what is it? Bile. And it makes stones. It dries up and you get gallbladder stones. So usually what people do, surgeons do, is, or you get sent to a surgeon and they cut it out and throw it away as if it's an extra part. And you don't want to lose your gallbladder. You don't want to lose any of the tissue in your body. They all have a purpose. But I'm not sure what they're looking for in that scan for you, Jill. And in terms of the radiation side effects, I don't know. I don't think that it's extensive, but if it were me doing this, and if I decided I need to do that test, it makes sense. Okay, we're going to do that test. I would triple up on my supplements for a week to 2 weeks beforehand, and then afterwards. I'd much rather have expensive urine peeing out more than I need to make sure my body is loaded with as much of the antioxidants to calm down the inflammation that occurs with something like a radioactive tracer dye. So I would increase, and I use GS sensitivity packs, and it's 1 pack a day, but I would do 2 to 3 packs, 1 pack 2 or 3 times a day for a week to 2 weeks beforehand and a week to 2 weeks after. And that's the recommendation I give to flight attendants and pilots, because they're exposed to radiation all day in their work at 35,000 feet up there. That's why pilots have the highest incidence of lymphoma of any profession, and flight attendants have the highest incidence of reproductive disorders of any profession, because they're exposed to radiation up there at 35,000 feet. That's their job. And so I explained that to them, and their jaw drops. They didn't know this, and I said, so you need to take double or triple the dose of these that a normal person or a person with a normal job that wasn't a high risk exposure job. So that's the way that I would look at it, Jill. Michelle, do you have anything you want to add to that one?
Yes, the gallbladder is so critically important. These are not optional organs. We shouldn't just take out appendix and gallbladder and tonsils at birth. They're important. We need them. And the research shows that so many of the people, just like Dr. Tom says, that have gallbladder issues, they're removed and they still have all the same symptoms because it's an issue with gluten. So I would do the wheat sumer and I would do the gut sumer, because the gut sumer has this excellent panel all about bile acid metabolites. Also, if you're digesting fat optimally. So those 2 tests could get a lot of insight into the root cause before they just start cutting out.
Really good point. Really good point. Absolutely.
Okay, next up is JD. Why is organ transplant a contraindication for the PRP spray? Does it matter whether you take the PRP spray with or apart from food? So 2 questions, Dr. Tom.
Okay, it doesn't matter if it's with or without food. No, just as I said, leave in your mouth for 15 to 30 seconds. Get that message up to the brain. It's the same concept as chocolate. Everyone should have a little dark chocolate every day. See the smile on Michelle's face? Because she knows it's true, dark chocolate. Everyone should have dark chocolate every day. And the way you do that with dark chocolate is you break off 1 square of the best dark chocolate that you can find, and you put it in your mouth. Don't let it touch your teeth. What? Don't let it touch your teeth. Let it dissolve in your mouth, because you're getting the taste buds, the message going up to the brain saying, chocolate's here. Chocolate. And you start getting those hormones produced in the brain that are called endorphins and enkephalins, 200 times more powerful than morphine. That's why chocolate is so healthy for us. The problem is that most of us eat way too much, throws our blood sugar off, and that just fuels more other problems. But have a square. Don't let it touch your teeth. Let it dissolve, because it's the oral thalamic tract from the taste buds in the mouth straight up to the thalamus in the brain that activates lots of responses in your brain. So the same thing is true here with the PRP sprays. You know, pump it in your mouth, a couple pumps in your mouth, just let it sit there 15, 30 seconds or so. And you're not going to do it in the middle of a meal, you know, but if you're just eating, you say, oh, I forgot the spray, I'll take it now. Fine, not a problem at all. And what was the other part of that question?
So organ transplants are contraindication.
Yeah, you don't want to.
Your immune system.
Right. When you've had an organ transplant, you don't want to enhance your immune system function. You just can't, because the organ is a foreign tissue in your body. And I'm no expert on organ transplants, but this is the accepted rationale that's taught to nutritionists from day one in pregnancy. And because the question is, well, how come a pregnant woman doesn't get rid of this fetus, which is foreign tissue in the body? And nature has found a way to say, that's okay, it's okay, just let that be, calm down, immune system. But with organ transplants, it's not the same. You know, it's not part of the Mother Nature's protocol. And I don't want to get all geeky with you about it, but the rejection of an organ transplant, you don't want to do anything that might contribute to strengthening the immune response and rejecting the organ transplant.
Okay, thanks, Dr. Tom. The next question is from YouTube. I have a small open leg wound, slight bleeding for 14 months. Started as a small nodule that swelled and burst. Been to primary care, wound care, now vascular and wound care, DO specialist. Any ideas? Continued negative cultures, negative skin puncture, negative x-rays and MRIs, negative vascular study, stopped zinc supplement and it got much better, but now no improvement since May. Won't totally close and heal. Help.
The zinc supplement tells us that there are nutrient imbalances that are inhibiting its healing. Some people with that kind of thing, is this an elder? You know, we don't know. What other biochemical things are going on? We don't know. My mother had a wound that wouldn't heal in the last year of her life, and it was a bed sore because she was bedridden, and they wanted to amputate her leg. And I said, absolutely not. That is not going to happen. And I used a skin serum product that just healed it right up. It was really quite amazing, but I don't think it's commercially available. I don't think so. But what I would want to do to know, I would want to know, what are the emergency brakes that are holding back the healing? What are they? Now, what I mean by that, you back out of a driveway and you say, what's wrong with this car? It's going so slow. Why is it not? Oh, the emergency brake. And you let go of the emergency, then you go, fine. So what's wrong with your healing process? How come it's not working? Oh, zinc helped to a certain degree, but there's more. There's more. There's other emergency brakes, and there's no way to know what they are until you get in there and you start exploring. And that's a great, great case to work with Michelle on, because, you know, and you know, Michelle's here, and she's just the best. You know, she's an investigator. She's going to sit there with you and look and see, well, it could be this, this, or this. This is most likely, and because you've been to the experts, wound care, vascular specialists, great. You're doing all the right things, but it's not in their world. If it was in their world, they would find it. but you probably didn't ask them, how many courses in nutrition did you have before you went into your specialty of vascular wound care? And because if you did, and if they answered you honestly, they would say none. Well, I went to a weekend course one time. They just don't know. It's not in their training. So you need someone who is highly trained in emergency breaks, holding the body back from healing. I guess that's the best way I could say it to you, and I hope that helps. Michelle, anything you want to add to that one?
Yeah, my wheels are already turning. Like if I want full blood sugar workup, then I want to figure it out.
Yeah.
And remember when you had that terrible bike accident and that wound on your leg, what you sprayed it with to heal? Is that what you used on your mom? Because it is available in the US.
I don't know.
It's called Briotech, and it's this topical skin spray. It's it took me a long time to find this product because I remembered it healed so well. It used to only be available as a veterinary product, but it works well. I am the biggest fan of this product. They also have one specifically for wound, but it's briotechusa.shop, and you can research this product. It actually helps your body do what it naturally does for fighting bacteria, viruses, and different infections. Great product.
Okay, I never interrupt you guys, but I use Briotech, and this is available on Amazon.
Oh, it is.
Great.
Yep. Yeah, it's one of the #1 recommended remedies for like healing piercings in your ears. So it's just a very healing product. That's cool that you use it.
Great.
Okay, next question is from JD. What is the neurocardio supplement Dr. Tom puts in his vitamin C water? Good question, JD.
Neurocardio mix from Brain Bean, and Ann will put the link in there for you.
Okay, this is from Cactus on Instagram. Dr. Tom has mentioned a doctor that has a very high pregnancy success rate. Can you let me know their name, please?
I don't know. Jeffrey Smith, the founder of the Institute for Responsible Technology, sent me her name about a year ago. And Ann will take a message or write it down and remind me, and I'll have to go back, and because I've never talked to her, but she was on his summit, and she had over 300 cases at that time with a 100% success rate. She's in San Francisco, and I will find that information for you, but I can't do it right now. But Ann will take the message and remind me tomorrow.
Okay, excellent. This is from Steph on Facebook. My friend has dry mouth causing chapped lips, little to no saliva. His doctor has taken him off some medication to see if it would help, but it does not help. Maybe gluten sensitivity. Thanks for all your help. Ooh, rule out Sjogren's, do a wheat tumor, and pursue autoimmune. This sounds Sjogrenish.
Exactly. Yeah, so looking for, that is a common symptom of an autoimmune mechanism going on. As Michelle said, Sjogren's is most common, scleroderma is also like that. There's a few different autoimmune conditions where the lubrication may not be quite what it should be. And it can be just in your mouth or your eyes, dry eyes, or in your joints. You would want to do a wheat zoomer, and also looking at ANA antibodies. Very, very common to see. Just for a starting point, it also could be Hashimoto's. I mean, there are many different autoimmune conditions that have those types of symptoms with them. But the goal is to identify the mechanism to see, is a person on the spectrum of autoimmune disease development. That's the goal. And I know that doesn't give you much information as to what to do next, except work with Michelle, because this is our world. This is what we deal with day in and day out. And so I would strongly suggest you explore this while it's just a nuisance of a dry mouth for your friend. Because if it is that your friend's on the autoimmune spectrum, then it's killing off tissue, killing off tissue, killing off tissue. And the symptoms will get a little bit worse over time until eventually there's new symptoms that show. And then once you have those symptoms, the average is 2.5 to 3 years and 3.5 doctors before you get the right diagnosis of an autoimmune disease. And that's from the Autoimmune Association. They did a study, a survey of doctors, and of course, all their clients, their patients. How many doctors have you seen before you got a diagnosis, right? So they just don't look for the earlier markers. And that's the whole world of what we call predictive autoimmunity, is looking for the markers of the mechanisms going on, killing off cells, killing off cells, killing off cells, before they've killed off so many cells that now you have the autoimmune disease. That's the goal here. So your friend, whoever your friend might be, really would do well to work with Michelle.
Yes, it's so fun to arrest the development of autoimmune disease, because it's absolutely something that can be done. And it's also beautiful to see how quickly the body heals.
Barbara's here from Michigan. Hello, Barbara. My doc told me I have arthritis in my hip. Well, welcome to the world of most of us. No constant pain, but I never know when I move if it's going to trigger pain. What can I do? That's a really good question. Arthritis occurs if it's osteoarthritis, just the regular old, you're getting old, you got arthritis in your hip. You know, they take an x-ray and they say you got arthritis. It's like you put a GM spare tire on the front end of your car. You know, one of those little rinky-dink tires that aren't worth much, but they'll get you to the gas station when you have a flat. That's osteoarthritis, is that your body's out of balance. It's not balance going down the road, meaning every step you take, you're out of balance somewhere. That's the world of a really good chiropractor, soft tissue work, massage therapy, increasing your flexibility. You would want to, you don't want to maintain what you've got, because what you've got in terms of flexibility is causing the problem. But it's going to get worse if the lifestyle continues that's causing the problem. So you have to learn what's the lifestyle mechanically that's causing this problem. And then you take actions to move in the opposite direction, more flexibility, more elasticity. And critically important to maintain your mobility and your flexibility as we age. Critically important. And it's hard to say what else to do. You ask, what can I do? Find a good chiropractor, find a good massage therapist, and you should not fall asleep on the table unless you're a sick one like me. The more pain that when they're working on it, the easier I go to sleep. You know, because I can just close down and just not feel the pain. That's one way to get me to sleep, right? But in general, massage therapists want you to come back to them, so they want you to feel comfortable. And what you want to say to them is, I want more flexibility. I love feeling relaxed, but I want more flexibility. That's the primary here, to my tolerance. Now, the rule of thumb, Barbara, is you go up to, but not into pain. And you have to work with the massage therapist in this example, so that, you know, if this is your leg, and if you're laying on your back and your leg's here, and I'm going to bring the leg up with the knee straight, you know, so your leg's straight, and I've got your leg on my shoulder, you're laying on the table, and I've got my hand on the back of your heel. And what I'm doing is I'm bringing it up and I'm stretching your hamstring nice and slow, and you're breathing in the midst of that. You're just taking deep breath. And I'm exaggerating how much we move forward, because you only move forward like a half inch. If you're at the level of up to, but because don't go any further, it's going to hurt. Okay, good. So you hold it right there. Then you take a deep breath. Then you go a little bit more. Then you go a little bit more. And then you go a little bit more. And what happens over time is you increase your flexibility dramatically, which changes your walk. It changes your stride. It changes everything about how your body moves. So with arthritis of the hips, especially, this concept is really important. I talk about it in You Can Fix Your Brain. I talk about the structural side of the pyramid of health, and I elaborate on it in there a bit. So you might want to pick up the book or the audio, and especially that section for your question tonight. Michelle, anything you want to add to that?
No, that was excellent. And I know we're at time, but we have to get to these 2 questions. Dr. Tom, is that okay?
Yeah, of course.
There's so many good questions and we could go on till midnight, but I think these are really important. So Beth says, one of my grandsons gets a tic, rotates his neck randomly, starting towards back to right, and then always to right. Whenever he eats even a small piece of cake or a small piece of bread, what's the best test for this? Wheat zoomer.
Right. Flashing lights.
Yes. That's so important for him to do wheat zoomer. And then Margisella asked a really great question on Zoom. Why do a wheat zoomer if somebody is already gluten-free? Wouldn't a gluten cross-reactivity panel show more information? Because over 95% of people that I work with that are on a gluten-free diet still test positive to something on wheat zoomer. It's a report card. You have to see if your gluten-free lifestyle is working. And so many people don't realize that they're getting contaminated with it. So start there. The cross-reactive panels are really important too, but wheat zoomer is critical. I run it on myself once a year because it's a job to keep it all in range.
Once you see that your wheat zoomer is positive, then you have the motivation to do a deeper level of investigation. Right now, you say, well, I'm gluten-free. I've been gluten-free for 1.5 years or 2 years, and I feel good about that. And you think that you've nailed it. And what we're telling you is you haven't nailed it. It's extremely rare that we get a negative wheat zoomer back on a first test. Even, for those who've been gluten-free for 5 years, it's extremely rare it's negative on a first test. The follow-up tests better be, if we did our job right and you've been compliant, they better be. But the first test, it's extremely rare. And these are very accurate tests. Why? We talked about it before, 51% of gluten-free pizza is not gluten-free. 54% of gluten-free pasta is not gluten-free. Well, it says right on the label, gluten-free. Right, but it's not. Live with it, right? And we had gluten-free pasta at lunch today, and it was really good. And Gio was taking these spaghetti noodles, gluten-free, and one at a time and just sucking them up, and and all the sauces on his face. I mean, it was really great. We took pictures because it's so funny to see, right? But he's just sucking up these big, long noodles, and I'm going. So after he sucks it up and swallows it down, then he goes. And I said, no, chew. I want him to chew. It's really funny. But we do gluten-free foods, and then we take our enzymes. No, before we sit down to eat, we take the enzymes. And you don't know this stuff because you think I've been gluten-free for 2 years and I'm fine. Well, it's a rude awakening. And I love the way Michelle said it. It's your report card. And so whether you get an A or a C, right? No, actually it's an A or an F. There's no middle ground. There's an A or an F. Let's do 2 more questions, Michelle.
Pass fail.
Yeah. Pass, fail. There you go.
Okay, this is from Jill. Would making a sandwich and then washing my hands carefully afterwards constitute a gluten exposure? Does gluten penetrate through the skin?
Yes, there's gluten-free. There's not gluten-free. There's gluten soaps. Soaps sometimes have wheat in them. And there's a couple studies came out, about 6-8 years ago on using soaps and breaking out. And what they realized was it was wheat. And when they use wheat-free soaps, it was not a problem. So there is some absorbance that occurs. There is some, not a lot, but some.
Okay, this question's from Zoom. I've learned that food sensitivity tests can be wildly off in terms of accuracy, reflecting the foods we eat most often as what we're most reactive or sensitive to, and showing high sensitivity to foods we may have never eaten or have not eaten in decades. Are there any ones you feel merit the price to test?
I'll let you answer that, Michelle.
Okay, so wheat sumer is a classic. It's just so critically important. It's so foundational, and it has a sensitivity and specificity or accuracy of 99 to 100% based on various aspects of the test. So you want a test that has that level of accuracy. And then the other Zoomers I find to be just as beneficial. Now, I've said this numerous times on these lives, that I'm not a big fan of starting with a 96 food sensitivity panel, because if you have like high levels of intestinal permeability, you're likely going to be sensitive to almost everything you're eating.
Right.
And so do the wheat zoomer. It includes that intestinal permeability panel. Get out the foods that really contribute to problems like corn and dairy and eggs and soy. Do those zoomers. If you find out that any of those foods are a problem, remove them. That's when I see the biggest changes in people's health, not when they remove zucchini or lemon, right? Now, those foods are the collateral damage from all of that intestinal permeability. Hang tight on those. They can be done down the road if we don't get the changes, but most often we get the changes when we remove the foods that are the most problematic.
Right. Agreed. Fully agreed. Amanda's here from Sydney, Australia. Hey, Amanda, thanks so much for joining. And Colin's in Bridlington, England. Thanks, Colin. I knew it was either England or Scotland, so somewhere in Great Britain. So glad to see that. Thank you so much for joining. All right, let's do one more.
Okay,
Michelle.
this is from Judy on Facebook. Please get your B12 checked. I had bad balance issues when I was deficient. I'm on injections. Just make sure if you're already taking a B12 supplement, you need to discontinue it to get accurate results. We talked about that. Otherwise, your results will be skewed. That includes all energy drinks containing B12. If you're on supplements, it's possible the B12 is not getting into your cell. That's methylmalonic acid, the test that can tell if you're actually utilizing the B12.
Right.
So it doesn't hurt to have it checked, and it's an easy blood test. So I agree, Judy. Thanks for that public service announcement.
Yes, yes. And Zuzu Sana is here from Toronto. And she says, thanks for everything you do for us. So you're all very welcome. It's really a pleasure. And before we sign off, I just have to say hello to Quincy. Quincy, hope you're having a great day, you and your family. Thank you so much for being part of our team. Next week, Quincy, say hello. Type in a message, say hello. Yeah.
She did. She said hello.
Oh, she did. Oh, good,
good.
I
I already hearted her message.
Oh, good.
Yeah, and hugs to those beautiful children.
Yeah. All right, everyone. Michelle, thank you. I mean, it just goes so fast, doesn't it?
It's the fastest hour of the month.
Yeah, the fastest hour. Thank you so much. And thank you everyone for being with us.